1 billion people across the world are thought to live with a mental health issue. Those who live with severe mental illness die 10 to 20 years earlier than the general population. But no, it's not what you think. It's not because of mental illness. It's primarily due to physical diseases that have been ignored in persons who have severe mental illness. We lose the lives of 8 lakh persons every year from deaths by suicide, and it's the second leading cause of death for young persons worldwide. In India, 150 million people in this country are in need of active interventions for their mental health. If anything, the last few months have made it clear that mental health is impacted by and in turn impacts many social, economic, and political systems. COVID-19 has further weakened our already struggling health systems. People are severely affected due to the loss of jobs, no access to food and shelter, vulnerability to health issues. This means that in the next 1 or 2 years, there is going to be a massive mental health crisis due to unemployment, economic hardship, domestic violence, and poverty. While this will affect many of us, the persons with pre-existing mental health issues, COVID-19 survivors, frontline medical workers, young persons, persons with disability, women, workers in the informal sector, the poor and other marginalized communities will be disproportionately affected. So yes, I'm talking of the 150 million that I mentioned earlier and many, many more. Now, these challenge points in mental health are easily visible, but we must look beyond the sector of mental health to try to solve them. For example, we intuitively understand and we know that living on the streets, being unemployed for extended periods of time, not knowing where a meal may come from, facing the constant threat of eviction or violence or social exclusion on the account of caste, gender, or sexuality is distressing. This mental distress, in turn, impacts the ability to hold a job, complete an education, inhibits participation in social, familial, or community activities, inhibits participation in employment, and of course diminishes resources for the individual, possibly their family, and their communities. So, poor mental health, as COVID has shown, is both a cause and a consequence of poverty, compromised education, gender inequality, physical ill health, violence, and other global challenges. And to tackle this, we need a paradigm shift in our perspective. The answers cannot come within the mental health sector alone. Mental health is an intersectoral issue. What do I mean by this? I'll give you a few examples. In a recent study in Indian schools, 42% of children said that they were bullied, teased, insulted, or physically harassed. Now, mental health support, supportive and positive relationships amongst peers, with teachers, with families, have been found to protect against a range of adverse childhood outcomes, adverse health and education outcomes for young persons. So even if I don't quote any other mental health statistics, we know that education and childhoods are deeply connected to mental health. If we take livelihoods, research says that living with mental health issues is linked to higher rates of unemployment and shorter durations of being unemployed. If we flip this equation, being unemployed for significant periods impacts a person's mental health. And thus, it's really surprising for me that mental health has remained invisible or implicit in development paradigms, even though it influences 10 of the 17 Sustainable Development Goals. Including and working on mental health is, in fact, a prerequisite to SDGs 1 to 5 and 10 at the very least. And those are no poverty, zero hunger, good health and well-being, quality education, gender equality, and reduced inequality. So today what I want to tell you that it is not enough to provide mental health services, but one must provide a two-way linkage to services that support livelihoods, shelter, social inclusion. And again, what do I mean by this? If I work in the field of HIV, AIDS, or TB, it's a good thing to know that mental health support actually provides better adherence to medication and medication regimes. Or, for example, if one works in childhood nutrition or infant health, one should know that maternal depression and maternal mental health pivotally affects childhood and infant health. So, what I want to leave you with today is that we cannot afford to ignore facets of mental health in any development work that we do. Mental health issues cannot be considered in isolation from other areas of development such as education, employment, disaster response, and human rights.